So at this juncture, I'm going to show you guys how to breastfeed properly and adequately. You have to latch your baby on properly. Yes, I have to show you guys at this time how to breastfeed. Just watch on. Hi everyone, this is Dr. Fausta Diala of the Faustalicious DIY Do It Yourself. Yes, today I'm going to be discussing a very important topic for our nursing mothers. The topic is on exclusive breastfeeding. It is very important at this point in time because our lockdown babies, our coronavirus lockdown babies are beginning to arrive with immediate alacrity. As you can see, those beautiful bundles are arriving joyfully and they are making us happy. Our bundles of joy, they are arriving and we are happy to have them. If we are happy to have them, we should also make plans to nourish them adequately. That is the reason why I decided to make this video on exclusive breastfeeding today, so that our mothers, our new mothers, will be properly armed with the correct knowledge as to how to feed and nourish their babies so that they can have a better, healthy future. Then watch on. In the end, I will show you how to properly breastfeed. In case you don't know, I'll show you that. So watch this video to the end. Let's dive right into the discussion for the day. Exclusive breastfeeding, EBF. Now, the question is, what is exclusive breastfeeding? Exclusive breastfeeding is feeding a baby exclusively, that is, feeding a baby only on breast milk, not partially with breast milk and formula or fully with formula without adding any water. Baby feeds only on breast milk in the first 6 months of his or her life. So no other liquids or solids are given. Cerelac is not given, pap akamu is not given, no other solid or liquid is given in the first 6 months of life, only breast milk. The only exceptions to this are ORS, multivitamin drops, prescribed medications are the only exceptions to this. So the World Health Organization, WHO, recommends that all babies should be breastfed exclusively for the first 6 months of their lives to achieve optimal growth, development, and good health. So after 6 months, now baby is growing bigger, baby needs more. So to achieve this baby's increasing nutritional requirements, you are now allowed to supplement with other home foods and other baby formula. And you have to ensure that these complementary foods are nutritionally adequate for the baby and safe. This complementary or supplementary baby food should be introduced gradually, one at a time, because by so doing, you would know if baby likes a particular food better than others. You would know if baby would react, is allergic to any particular food or the other. Because when you give everything together and baby starts reacting, vomiting or stooling or having any form of symptoms, you would not know, you would not be able to pick exactly which food the baby is reacting to. That is why we recommend that you introduce these different baby foods gradually and one after the other, so that anyone that the baby reacts to, you will be able to pick it out immediately. As you continue feeding the baby on these other baby food, home food, and the rest, you should also continue breastfeeding the baby for up to 2 years and beyond if you so desire. And if the baby still demands for breast milk, yes, 2 years and beyond, I do it. So at this juncture, I would like to talk to you guys about the first milk that is produced after a woman delivers. That first milk, it is thick, yellowish in color, and it is called colostrum. Colostrum is high in protein, low in sugar, rich in antibodies, especially IgA. IgA is immunoglobulin A, and this IgA protects the epithelial surface of the gut and protects it from invading pathogens. So it protects the digestive system, the throat, the nose from possible invading pathogens. Please, I know culturally in some places, some people waste that first milk. Please do not waste it. It is very healthy and protective to your babies. Now, let's go into the benefits of breastfeeding for both the mothers and the babies. The benefits of breastfeeding is all encompassing. It benefits the babies and it also benefits the mothers. So for the babies, it is very pertinent to note that breast milk supplies the baby with all the nutrition he or she needs in the first 6 months of life. Breastfeeding protects against diarrhea because the baby is sucking directly from the breast, so you don't need to sterilize the breast like you do with bottles, plates, spoons, etc. So breastfeeding, breast milk, protects the baby against common childhood illnesses like upper respiratory tract infection, where you see the baby having runny nose, coughing, sneezing, having nasal congestion, and pneumonia. It helps to reduce risk of overweight or obesity in infants, childhood, and in adolescence. It protects against various febrile illnesses in infancy. So my baby is having fever every time the body is hot. When you breastfeed properly and exclusively, you won't have to worry about such febrile illnesses. Breastfeeding also helps to reduce the risk of food allergies. It helps to reduce the incidence of food allergies. Some allergic conditions like asthma, recurrent rhinitis, atopic dermatitis that affects the skin, eczema that also affects the skin, and respiratory tract allergies. Breastfeeding has also been seen to protect against diabetes, obesity, dyslipidemias in adulthood. Though this is controversial, but studies have shown that it can protect against these chronic diseases, these chronic conditions in adulthood. Though unclear too, it has been shown in a study that breastfeeding for 6 months or beyond protects against childhood blood cancers like leukemia. In preterm babies, it has been shown that breast milk breastfeeding protects the baby against necrotizing enterocolitis that affects the baby's gut. Preterm babies. A study has also shown that breastfed babies are smarter and have higher IQ than babies that are not properly breastfed or that did not receive breast milk at all. Breastfeeding is a game changer for the incidence of high mortality rate in the developing countries. So breastfeeding is an effective intervention that improves survival rate of babies, of infants all over the world, especially in the numerous developing countries in our world, my own country inclusive. And it also reduces the risk of sudden infant death. So exclusive breastfeeding helps to increase your baby's survival rate in the early days. Now I'm going to talk to you about the benefits of breastfeeding for their mothers, because I know that culturally in some places or even out of personal decisions, some mothers have decided not to breastfeed their babies, erroneously believing that with breastfeeding their breast is going to become flatter, is going to become flat. So they erroneously believe that that breastfeeding is going to make their breast flat, and they will not have the sweet 16 looks, and maybe their husband's attention will be shifted to younger girls who still have their breast pointed and all that. But that is an erroneous belief. Every woman, as you advance in age and grow older, whether you have breastfed before or not, at a certain age, your breast would certainly begin to sag. There is a song we sing in my language, Aradadago, nke kwọtọ kagadakwa, ụmụ nwanyị na-efegharị, eburubago, eburubaga, baby, baby, fire the go. Let me stop there. But the bottom line is that aradarada adago nke kwọtọ kagadakwa, meaning that the breast that has sagged. Even the one that is pointed today will still sag. So don't starve your babies of the best nutrition they can get in their lifetime because of cosmetic reasons, because that breast that is standing pointed today will still sag tomorrow, whether you breastfeed or not. That is the truth, the simple and sad truth. Yeah. So for the mothers, breastfeeding helps you to lose more weight, to lose weight faster after delivery. It helps you to get closer to your pre-pregnancy weight faster. Breastfeeding also helps your uterus to contract and goes back to its pre-pregnancy size, because when you breastfeed, the sucking reflex from your baby stimulates your brain to release a certain hormone called oxytocin, which helps in milk ejection as well as uterine contraction. So you get flatter tummy faster when you breastfeed. So this oxytocin is secreted in higher quantity when you are breastfeeding. So everything works together to make you bounce back to your pre-pregnancy state when you are breastfeeding properly and adequately. I cannot overemphasize on this breastfeeding issue, because oxytocin does a lot of things to help the mother while she is breastfeeding. It also helps to reduce bleeding. It helps to reduce bleeding after delivery. It helps your uterus to involute faster to its pre-pregnancy size. What are you talking about? Why won't you breastfeed? The benefits are enormous. Breastfeeding helps you to bond nicely, creates a nice bonding between the new little baby and their mother. That is why babies, they love their mother a lot. Their mother is everything to them. When you breastfeed, you see this bonding is number one. Also, mothers who breastfeed have little risk of postpartum depression. As you can see in some mothers, after delivery, they start behaving as if they have some kind of psychological problem. They become depressed. But when you breastfeed, it helps to reduce this risk in some mothers who have the tendency to be depressed after delivery. So exclusive breastfeeding also may pause your ovulation and menses, that within the period and even beyond, within the period that you are exclusively breastfeeding your baby, you will not ovulate and you will not have menses. And this is a great way of having natural family planning, and a way that nature uses to space your pregnancies, so that it will not be that you just give birth immediately you have conceived again. Nature uses this to space your pregnancy and birth, because as you are breastfeeding, prolactin is secreted. Prolactin is responsible for the milk production. It is secreted in very high quantity, and it inhibits ovulation and menses. Free and easy way of having family planning after deliveries: exclusive breastfeeding. Breastfeeding also reduces mothers' disease risk, like high blood pressure, arthritis, high levels of fat in your blood, hypercholesterolemia, dyslipidemias, heart diseases, type 2 diabetes mellitus. So breastfeeding seems to provide women with long-term protection against the above listed diseases, and even protects you against breast cancers, as the total time as a woman spends in breastfeeding is linked with a risk reduction in breast and ovarian cancers. Breastfeeding saves you some money and time. It is free of charge. You're not going to the market to buy it. You don't have to spend money on formula until after 6 months. You don't also have to calculate how much milk your baby needs to feed on per time or per day. You just feed your baby on demand. There is no bottle cleaning, no sterilization. You feed the baby straight from the source. That is called organic breast milk. So you don't need to get out of bed at night to prepare baby's milk. The milk is there. You just carry your baby and feed, stress-free. When you are outside with your baby on a journey, there is no need of looking for hot water to warm your baby milk or whatever. The breast milk that you give is already warmed by nature. God had already prepared this special meal for your baby. It is just give the baby the breast milk the way it is, and it is okay. Breast milk is the only food that God in heaven prepares by himself. He made it, put all the adequate ingredients that the baby needs, keeps it warm at every particular point in time. You don't need to rewarm it, except for working class or career women, or those that always have to go outside for one reason or the other. They might now express the milk in bottles, put in the refrigerator, which preserves the milk nicely. Then your caregiver, while you are away, can warm up the milk and give to the baby. except for that. But once you're feeding directly from source, you don't need rewarming because breast milk is always at the right temperature and ready to drink. The benefits of breast milk is so numerous that most health agencies recommend breast milk for all breastfeeding for all mothers and for all babies, except for mothers who have some kind of disease state that giving their breast milk to their babies would risk the baby's health. Except for such mothers, if you are healthy, you don't have any infectious disease, feed your baby. Breast milk is the best for your baby. When you breastfeed your baby properly and adequately, you reduce your hospital visits for different kind of infections and febrile illnesses. And when you are going out with your baby, you travel light because you don't have to carry big bag, one big bag for bottles, one big bag for formulas, etc. You travel light because your baby food is on you. So at this juncture, I'm going to show you guys how to breastfeed properly and adequately. You have to latch your baby on properly. Yes, I have to show you guys at this time how to breastfeed. Just watch on. How to breastfeed. Sorry, you didn't see the breastfeeding demonstration because the power supply went off. Don't worry, in my next video, I would demonstrate breastfeeding. So feel free to like this video, comment, share to everyone, mothers, fathers, everyone. Let it get to all nursing mothers because they need this information to be properly equipped on on the benefits of breastfeeding and its importance. It's immeasurable. Thank you very much for watching. Bye.